What's up, TUMNAD lectures? In this video, we are going to look on what we call the fetal circulation. If you find this video helpful at the end of it all, please make sure you like the video, comment down in the comment section, and please subscribe. Let's go ahead and get started. So now in this video, we are mainly focusing on what we call the fetal circulation. And of course, when we talk about fetal circulation, this is going to be the circulation of blood from the maternal side through the placenta and then feeds what we call the growing fetus while inside what we call the uterus. That's what we mean when we talk of fetal circulation. We are circulating blood direct from the maternal side through the placenta and then it enters what we call the fetus for the continuous growth for 9 months. Okay? We're going to be looking at what we call fetal circulation in two parts. We shall see what's going to be happening before birth, what happens before birth, and even also what's going to be happening after birth. What are those changes that are going to be happening after birth? Okay? But for right now, we are going to be starting direct off with what we call what's going to be happening before birth. Okay? But before you go into that, we want to go ahead and see the anatomical orientation of this diagram, and we see exactly how we call all these different parts before birth. Okay? We come over here. This one here is this kind of maroon structure here. This structure is super very important. Is everything during fetal life. This is the guy that's going to be feeding the fetus with oxygen, feeding the fetus with all the required kind of the nutrients, allowing the removal of different kind of the waste during fetal life. Okay, so now this is the guy whom we call the placenta. Okay, so now this guy here is what we call the placenta. Okay, and this placenta is so much beautiful in a way that it delivers what we call oxygen. Okay, delivers what we call oxygen. It delivers all the required kind of nutrients. Okay, it delivers all the required kind of the nutrients, and even also it helps in what we call waste removal. Okay, because of that, this kind of the placenta is going to be serving the role of the kidneys, is going to be serving the role of the lungs, is going to be serving the role of what we call the GIT, because during that time, all those kind of the structures I just talked about, they are not going to be functional. And for that reason, the placenta is doing everything during that time. Until when the baby leaves the uterus, those structures, they start now working independent. Okay? So now the placenta is such a beautiful thing to know. Okay? When we come over here, we have this black-like structure here, which is going to be housing two kind of the beautiful kind of the blood vessels. This structure here is what we call the umbilical cord. Okay, this structure here is what we call the umbilical. Umbilical cord. Okay, and it is within this kind of the umbilical cord that we are going to be having our great kind of the blood vessels. What are those blood vessels? We have these blood vessels which are a bit somehow we are somehow bluish, not so much bluish. They are not so red. They are just there in that kind of the color. Then we also have this kind of the blood vessel which is a bit somehow a bit more reddish. Okay, so now in other words, they are going to be having 3 blood vessels within what we call the umbilical cord. How do we call these blood vessels? These kind of the blood vessels which are a bit somehow a bit bluish, and they are going to be 2 in number. They are going to be originating from what we call the internal iliac arteries. These kind of blood vessels are what we call the umbilical arteries, and they are going to be 2 in number. Okay, so now these kind of blood vessels here are what we call the umbilical arteries. Okay, are what we call the umbilical arteries. Now, this one here, which is a bit so much reddish, this one here is so much very important. He is the one that's going to be delivering blood which is rich in oxygen, blood which is rich in nutrients, and all that from the maternal side, and then it pulls it through what we call the placenta, and then feeds what we call the growing fetus. It is such a very beautiful kind of the blood vessel. You know how this blood vessel is called? This kind of blood vessel is what we call the umbilical vein. It is only one umbilical vein. Okay, so now this one here is what we call the umbilical vein. Okay, is what we call the umbilical vein. So the umbilical vein is going to be only one. Okay, Now, when we move with this umbilical vein, we'll come over here. We have this structure here, which we call the liver. And of course, during fetal life, this liver is not so much functional, but something which is so much beautiful is going to be happening. When this kind of the umbilical vein comes over here, it is going to be having this beautiful kind of this shunt. Okay, you see this kind of this beautiful shunt here. That's going to be shunting this blood to bypass the liver and it enters into what we call another circuit we are calling the inferior vena cava. This kind of this shunt here, from here up to here, is so much special. You know how this beautiful shunt is called? This beautiful shunt here is what we call the ductus venosus. Okay, this one here is what we call the ductus what we call the ductus venosus. So much beautiful. But before that, we also have a very small kind of a branch which is going to be entering into what we call the liver sinusoids, and of course going to be feeding the blood to the liver just for the case of continuous growth, because the liver also needs some nutrients for its growth. Okay, so we're also going to be having a very tiny kind of the branch which goes into what we call the liver sinusoids. Okay. So we have said that this ductus venosus is shunting blood from what we call the umbilical vein direct into this maroon kind of this structure here, which we call the inferior vena cava. Okay, so now this structure here is what we call the inferior vena cava. That's for the case of the short form. Okay. Now, when you see this kind of the inferior vena cava, it is now leading directly into what we call the right side of the heart. Now, it is going to be leading inside here, what we call the right atrium. So now, this structure here, or this chamber here, is going to be what we call our right atrium. Now, there is something which is so much beautiful as this kind of the inferior vena cava enters inside what we call the right atrium. Now, just towards the entrance of what you call the inferior vena cava, it enters into what you call the right atrium. It is some kind of a beautiful kind of a valve that's going to be there, especially during fetal life. You see this beautiful kind of this valve here. This valve here is so much special and is very important in playing a role of directing blood to bypass moving down into what you call to the right ventricle, but it directs it towards a very beautiful kind of the hole, which I'm going to talk about. This valve here is what we call the eustachian valve. Okay, this structure here is what we call the eustachian valve, just on the entrance of what we call inferior vena cava. It directs the blood from moving down to the right ventricle and it directs it into this kind of the structure which we call the foramen of valve. Okay, so now when you come over here on this structure here, in what we call interatrial septum, we have this beautiful kind of the hole which we call the foramen of valve. So now this structure here is what we call the foramen of valve. So I'm going to denote it as F. I'm going to denote it as FO. So that one's going to be what we call foramen of valve. It is helping shunt the blood from the right side of the heart to what we call the left atrium. Okay. We shall also go ahead and see why is this blood shunting from the right atrium to the what we call the left atrium. Okay. Then when we come over down here, this structure here, this chamber here is what we call the right ventricle, and then this one here is going to be what we call the left ventricle, and then this one here is going to be what we call the left atrium. Okay, that's just anatomical makeup. Okay. Then when you come over here, this one here is going to be what we call our pulmonary trunk. Okay, I'm going to denote it as PT, and of course, as the pulmonary trunk moves up here, it's going to be bifurcating into what we call the right and then the left pulmonary arteries. Okay, so now like this one here is going to be what we call the left pulmonary artery, and then this side here is going to be what we call the right pulmonary artery. Okay. Now, there is something which is so much beautiful during fetal life, or for the case of what we call pulmonary circulation. Because the lungs are not functional, we are going to be seeing the reason why the lungs are not going to be functional and the kind of the pressures which they are going to be generating. There's this beautiful kind of this shunt which shunts blood from entering into the lungs, and then it shunts it into what we call the aorta. This beautiful kind of the shunt here is so much special. This one here is what we call the ductus arteriosus. Okay, so now I'm going to be denoting it as ductus arteriosus. It is shunting the blood, which is supposed to go to the lungs, and then joins what we call what we call the aortic, and then it is distributed all over parts of the body of the fetus. Okay. And then, of course, this beautiful structure here is going to be what we call our aorta. It's going to be now the ascending aorta, aortic arch, and then the descending kind of the aorta. Okay, so now this one here is going to be what we call our descending aorta. Now, at the descending aorta, as it moves down and down and down, it's going to be now breaking into two. And these are going to be what we call like the right common iliac artery and then the left common iliac artery. And of course, eventually, they're also going to be now breaking into further the external iliac arteries and then also the internal iliac arteries. External iliac arteries, internal iliac arteries. Now, it is within the internal iliac arteries that we are going to be having our beautiful kind of the arteries, which we call the umbilical arteries. And these umbilical arteries, they are going to be now delivering the blood, which is going to be a bit somehow deoxygenated. However, it contains approximately 50% of the oxygen. But this blood is going to be rich in a lot of waste, which are supposed to be taken to the placenta, and then it is taken to the maternal side, and then it will be eliminated, okay, of what we call the fetus, okay. And of course, this side here, these are going to be our lungs, are going to be our capillaries, and also the air sacs for exchange of what we call gases. But of course, during fetal life, the lungs are not going to be functional, okay. So now that briefly covers what we call the introductory orientation of what we call fetal circulation. Now, there is something which is so much beautiful before we go into what we call the flow of blood during fetal life before birth. There's something which I want to talk about, which we call the heart pressure differences. There is going to be a difference between the pressures from the right side and then also the left side. Okay, we need to first pay attention on this, because when a baby is born, this kind of the pressure changes is going to be reversing. So now what's going to be happening within the lungs during fetal life? There is not going to be oxygen. So now these air cells are just going to be filled up with some little bit of the fluids. There is not going to be oxygen, all that. Now, meaning that within these air sacs, which you're calling the alveolus, there is going to be no oxygen. Okay, there's going to be no oxygen. Now, as we have these pulmonary arteries which are going to be passing by on those kind of the air sacs as they want to collect the oxygen, but because there is no oxygen within this kind of the alveolar sacs, guess what's going to be happening on this kind of the pulmonary arteries? They are going to undergo what we call vasoconstriction. Okay, now these kind of the arteries, they are so much sensitive. They are always opening whenever there is high levels of oxygen. But if there is no oxygen, they are going to undergo what we call vasoconstriction. Okay, so now it means now if this kind of the artery is undergoing what we call vasoconstriction, it means the entire pulmonary arterioles are also going to undergo what we call vasoconstriction, because the entire lung is not going to be having oxygen. For that reason, the entire lung is going to be having pulmonary vasoconstriction. Now, it means that if you have vasoconstriction within the lungs, you are going to be increasing the pressures within the pulmonary circulation. Now, you're going to be increasing the pulmonary pressures. Okay, you're going to be increasing what we call the pulmonary pressures. Now, because of that, you're going to be now increasing an extensive amount of the pressures that the right side is going to be generating. Okay, meaning that if you increase the pulmonary circulation pressures, you're also going to be generating an extensive amount of the pressures within the right ventricle. Okay, meaning that even also you're going to be having an extensive amount of the pressures within what we call the right ventricle. Okay. So now, because of that, if we have high pressures within the pulmonary circulation and we have high pressures within the right ventricle, it means the right side of the heart during fetal life is going to be having higher pressures compared to what we call the left ventricle. And for that reason, that one also to a less extent explains why there is going to be shunting of the blood from the right atrium into what we call the left atrium, because of that kind of the pressure gradient. Because we don't want this blood to move into here, because if it moves into the right ventricle and then it moves into what we call the pulmonary circulation, there's not going to be now the significance of blood moving to what we call the pulmonary circulation, because the lungs are not going to be functional. Okay, so now this kind of increase of the pressures within the pulmonary circulation as a result of what we call hypoxemia in what we call the air sacs of the lungs. This kind of the phenomena is what we call hypoxic vasoconstriction, okay, which is going to be causing vasoconstriction of pulmonary arterioles of all what we call all the lungs, okay. So now you're going to be having something which we call hypoxic, hypoxic vasoconstriction. Okay, we're going to be having something we call hypoxic vasoconstriction, whereby all the pulmonary arteries are going to be constricting during the entire life of what we call the fetus while in utero. But of course, immediately after birth, you're going to be seeing now it reversing. The pulmonary arteries are going to be widening, and then it allows now the blood to move from the right side of the heart into what we call to the lungs because of the reduced kind of what we call pulmonary pressures. Okay, so now all that one makes a lot of sense. Okay, and that is why during fetal life there is going to be very little blood which is going to be coming to what we call the right ventricle. Okay, and of course now you have already known the reason for that. Okay, before we go very far, we also have a very small kind of the opening which allows the use that blood from the heart itself, and we call it what we call the coronary sinus. Now, this coronary sinus, it has another beautiful kind of the structure that's going to be closing that kind of the coronary sinus to avoid the blood from going back. That kind of the structure is what we call the Sebacean valve. Okay, also have what we call a Sebacean valve that blocks the blood from entering back into the coronary sinus. Now, before we go very far, take a look at this kind of the valves, which are called the Sebacean valve, and even what we call the Eustachian valve in the right atria. Take a look at that one by yourself. Now that you have seen what we call the Sebacean valve and what we call the Eustachian valve, let's go ahead and see what we call the order of blood flow in what we call the fetus before birth. Okay. So now the whole process is going to be starting with what we call the placenta, because the placenta which is going to be sucking blood from the maternal side and then feeds what we call the fetus. So now our first step in what we call blood flow during fetal life is going to be what we call the placenta. Okay, so now our placenta is going to be our first step. Okay, and then the second step is going to be now blood from the placenta is going to be moving through this beautiful kind of the blood vessel which we call the umbilical vein. Okay, we're going to be now our second step as what we call the umbilical vein. Okay, and then when we come over to the step 3, we said that the umbilical vein is going to be giving us a beautiful shunt, which is going to be bypassing this blood from the liver into what we call the inferior vena cava, and we call that kind of the shunt as what we call the ductus venosus. Okay, so now we are going to be having what we call the ductus venosus as our third step, and then of course our fourth step is going to be what we call the inferior vena cava. Okay, it's going to be what we call the inferior vena cava. Something so much beautiful. Okay. Oh, before I go very far, you see now the inferior vena cava is moving all down here. Now he is going to be now draining up the used up blood from the lower extremities of the fetus. But of course, as it comes over here, we are going to be now having a mixture of what we call oxygen-rich blood and even also the deoxygenated blood. It is something which is so much beautiful. You're going to be having now the mixing of the blood here. That's why it's becoming a bit red. Down is a bit bluish, but as rich as it's becoming a bit red because it is joining up what you call the ductus venosus as it is dropping in oxygen-rich blood. Okay? And then of course the inferior vena cava is dropping the blood into what we call the right atrium. Okay, so now our fifth step is going to be what we call the right atrium. Okay, and then when we go to the sixth step, we said that most of the blood in the right atrium does not move into the right ventricle. It passes through this structure which is between the interarterial septum, and we call that this structure here with this opening, which is going to be allowing blood to move from the right atrium to what we call the left atrium, is what we call the foramen of valve. So now our sixth step is going to be this hole which we are calling foramen foramen valve. Super very important. And of course, it allows the blood to move into what we call the left atrium. So now our seventh step is going to be what we call the left atrium. Okay, so now the reason why I'm not paying much attention on this kind of the order of movement of the blood here, because here we are going to be having very limited blood coming down here into what we call the right ventricle. Approximately around 20% of the blood will move into what we call the right ventricle. Okay, and of course in most cases that's the blood is going to be coming from what we call the superior vena cava, but approximately around 70 to 80% of the blood in the right atrium will be shunted into what we call the left atrium through what we call the foramen valve, and that creates a difference in what we call circulation from what we call the adults. Okay, and then also from the left atrium, this blood is not going to be moving into what we call the left ventricle, and of course going to be bypassing what we call the mitral valve. So now our eighth step is going to be what we call the left ventricle. Okay, the left ventricle, and of course the left ventricle will squeeze this blood as if it has never squeezed before, and this blood will enter what we call the aorta. Okay, so now the ninth step is going to be what we call the blood is going to be now entering what we call the aorta. Okay, and of course if it passes to the eye, it's going to be supplying the upper extremities, and even also moving down to supply the different parts within the lower parts. Okay, so now our 10th step is going to be what we call now the body tissues. Okay, going to be supplying now the entire body tissues. Now something which is so much beautiful is that they use that blood from the entire body tissues. It's now going to be collected into these beautiful kind of the arteries that are going to be coming off from what we call the internal iliac arteries. And these beautiful kind of the arteries are what we call the umbilical arteries. Okay, so now from the body tissues, we shall have now our blood moving to what we call the umbilical arteries. Okay, and then of course umbilical arteries are going to be leading into what we call the placenta. Okay, it will now take it back to the placenta. Okay, back into the placenta. So now you have seen, now we have saturated the blood all over the body tissues and we have brought it back to the heart, and that summarizes what we call the fetal circulation. Okay, so now that is what we call fetal circulation in short. Okay, now that briefly covers fetal circulation before birth. So now what you're going to do next is that you're going to be now seeing what is going to be happening when this kind of the umbilical cord is cut. What's going to be happening? What are those kind of events that are going to be happening? And of course, we're going to be having what we closure of different kind of the shunts that are going to be located within what we call the heart, and even also on that what we call the liver. Okay, thank you very much for watching. And if you think whatever I've talked is making sense, is really adding to you, you're benefiting, please you can hit like button, comment down in the comment section, and please subscribe. So now in the next video, we're moving into part 2, which is going to be explaining on the events which happens immediately after the birth. As always, TUMNAD, until we meet next time.